Hello, everyone. Jen Rumbalski here from La Crosse County Health Department, Director of the department. Today is Tuesday, May 19th, and we are with you today to again give you some information and updates about COVID-19 and its status in our communities. And as we usually do, we have some extra guests on the show today, so we're excited to have those folks come on and talk a little bit as well. So wanted to just start out first by, again, giving our case counts and the information relating to what numbers we have in La Crosse County as well as the state of Wisconsin. As of today, we have not had any new cases from yesterday. Our total case number is at 47, and we have 36 who have recovered. And we also have one of those 47 is hospitalized at this time. Our total negative case number or case totals are 3,593, which puts us at a 1.3% positive cases of total tests completed for La Crosse County residents. In the state of Wisconsin, the numbers are for positive cases, 12,885. That went up from yesterday by 198 cases. In addition, we have a total of 148,237 negative test results in the state, and that is up 3,735 from yesterday. And we have 2,110 individuals who have required hospitalization, and 42, that is an increase of 42 individuals from yesterday. And death count so far in our state is 467, and that is an additional 8 individuals in our state who have passed away from COVID-19 over the last day. We have then the percentages, looking at just the yesterday to today, the total is 5% of the tests have resulted in positive, and overall we are at 8% of the total number tested have been positive for COVID-19. So that percentage is coming down from what it had been in the past, which is good news. But I think maybe a bit preliminary considering some of the new changes in the state, particularly the safer at home order not being in place. We do anticipate seeing additional case counts go up once we get to about a week or two post safer at home order. So, or the order being overturned. So I do just want to remind folks that we have a testing event coming up, and that is in the city of Onalaska. And we are joined today by the mayor of the city of Onalaska, Kim Smith, as well as the chief of police, Chuck Ashbeck. So thank you both for joining us today, and you can take it away.
Sure. Thank you for having us here today, Jen. We really appreciate working with you over this period of time while we're dealing with the health crisis. It's been a hard time for our community, a lot of unknowns, and it's helped having your wise leadership to help guide us through this process, you and the county health department, as well as the state and federal guidelines. We look forward to just continuing to work together, and we're really happy to be able to host this event at our Omni Center coming up this week so that we can get some more data and continue to address the COVID-19 crisis with science and data rather than opinions and speculation. So thank you.
All right. Yes, thank you, Director Rumbalski, for having me here today to be able to speak about the testing event that is occurring this Thursday, May 21st, at the Omni Center on Riders Club Road. My primary focus today is to let the public know that we'll be attending the testing site, the best way to travel to the testing site. That will be the most efficient way for you to basically get in line through your vehicles to the site. So I'll walk through briefly what I would advise is the best way for the public to attend. And so I'll start with anyone traveling from the south, whether that's from the city of the Crosse or from I-90. If you would exit at exit 3 at Highway 35 and travel north on Highway 35 through the city of Onalaska and As you approach, you'll see signage to indicate that Riders Club Road, which is the road that the Omni Center is on, that will be closed for eastbound traffic. So we're gonna advise public to continue going north on Highway 35, and please exit at the second roundabout, which is Mason Street. Please continue east on Mason Street until you reach East Avenue North, as you can see from the map on the screen. When you reach the stop sign at East Avenue North, we're gonna have you take a right-hand turn or south on East Avenue North and travel down East Avenue North until you get to Riders Club Road. At that point, you'll take a right or westbound on Riders Club Road. And depending on the amount of attendance for the testing, you may find backups all the way out to East Avenue and potentially on East Avenue. So at some point, when you're traveling on Mason Street to East Avenue, you may see traffic back up as they wait in line to get through the testing site. And so once you get on Riders Club Road, we are going to divide Riders Club Road into 3 lanes. And the 2 lanes on the north, the 2 right-hand lanes will be the testing lanes. We'd ask that citizens pick whatever lane is available and follow the cones up to the Omni Center. And when you get up near the Omni Center parking lot, you will see pre-screeners there that will then, from the health department and the National Guard, which will then get your information and ask you various questions. So essentially then the people coming from the north, as in Holmen or other cities north of Onalaska, please come down Highway 35 southbound, and essentially then you would just turn eastbound on Mason Street, just as I had gone through for the other citizens coming from the south. So my goal here is, again, please follow Mason Street around to East Avenue and to Riders Club Road to gain access to the testing site. A couple other points that I would like to just point out for our citizens in Onalaska that live near the Omni Center, particularly 3rd Avenue North, Red Cedar Court, 4th Avenue North, and Ridgeway Avenue. Those neighborhoods that butt up to Riders Club Road, we will have barricades set up so you will not be able to exit onto Riders Club Road during this event, probably anywhere from 9 to 10 a.m. on Thursday until the event is over. So please, if you need to leave your neighborhood or get back into your neighborhood, exit from the south on Grove Avenue. For media that's attending the event, I would ask that you essentially stop at East Avenue North and Riders Club Road and check in with the Onalaska police officers that will be providing traffic control at that intersection and provide identification. And they will essentially let you travel through on the bypass lane. And the media staging event area will be the Aquatic Center parking lot, which is directly adjacent or south of the Omni Center parking lot. And once you're finished, you will then exit to the west towards Highway 35. On a last note, I would just say that now the citizens that attend and get tested, you'll exit out the parking lot and turn right on Riders Club Road out and head out to Highway 35, where you can enter the roundabout and head either north or south to whatever your preference is. Thank you.
Thank you to both of you. Appreciate you so much being on today, and the partnership again that we have with you guys in the city of Onalaska, and just thanking the Onalaska residents, knowing that this will be a little disruptive to those that live around the area, but it is an extremely important event. And at this time, I just want to share a little bit to remind folks about the who should be coming to the event. So again, anyone who is 5 years or older and is currently experiencing any of the following symptoms. So fever, cough, shortness of breath, or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, or a new loss of taste or smell. Again, this is nasal swab testing. It is not nasal pharyngeal swab. So for those that have heard how far the swab needs to go in, this particular swab testing mechanism is not as far, not as deep that it needs to go to the back of the throat. And just a reminder as well, any mild symptoms along the lines of what I just explained, we really encourage you to come to the event and get tested. It is really important, I think, for individuals to know the status, if they have any symptoms, that they really do have COVID-19 or not only for yourselves, because this disease, this virus can change quickly in terms of what happens to the body. It can go downhill rather quickly for individuals. Thankfully, the majority do not have severe symptoms, but at least if you are aware, if you are positive, then you can be prepared for that. In addition, no one wants to be spreading COVID-19 to anyone else, especially their family members and loved ones. So it is really important to know your status, particularly if you have symptoms. So we highly encourage you to come to the testing event if you have any of those symptoms, no matter how mild. And we are just really glad to be able to have the testing event. And again, thanks to the National Guard and those that have partnered with us, City of Onalaska, to help us have a site. We are looking at additional events, and we'll have more information to share in the future about those, perhaps even by Friday's media briefing. The testing events are an important aspect to where we need to be. So right now, if we think about various phases, knowing that we are currently in the middle of a peak of virus activity, we don't know, because we don't have enough testing to understand yet. Are we at the beginning of that peak, the top of the peak, the downhill slope of that peak? We don't know, because right now the data we look at is all based upon whatever levels of testing we currently have, which just are not enough levels of testing. So this testing event and future events are so important for us to be able to have the information we need to make good decisions and to best guide our community, whether it be you all as individuals, for your families, for your communities, your church, your business. All of those require an understanding of what the data tells us and what it advises us in terms of what phase we're in. Should we be loosening or tightening our guidelines? And right now we're at the most restrictive tightening of guidelines. And I think there might be a misconception out there that we can loosen guidelines because we no longer have a safer at home order. And I reiterate that it doesn't really matter if we have the order or not. The data tells us that we are in a place where we need to be in the most restrictive with guidelines. And again, I'll just reiterate what those guidelines are, and they're all found in the statement that I have previously made in regards to the call to action. And actually, I won't run through all of those guidelines for you, but there are 8 of them, and they are really specifically about decreasing individuals being in close contact, not congregating with others outside your household, all of the good behaviors that we talk about with covering your cough if you have one, if you're ill at all, staying home and not going out into the community, making sure you're washing your hands frequently, all of those items. But again, it really is about close physical contact with others, particularly outside of your household. And as we come into Memorial Day weekend, recognizing that individuals want to be out and about, want to have gatherings, want to get together with others, this is not a time for us to be doing that yet. We want to be driven by data, and we have to advise you based upon that data, and the data does not tell us that we're ready yet. to be congregating. So despite the fact that traditionally on Memorial Day weekend, we typically like to get together with others, we cannot yet be doing that. And we do not need in order to know that that is not the right thing to be doing. The last thing that I want to talk about is just in general, I looked back at, when COVID-19 first sort of started in La Crosse County, not cases necessarily, but communications was the first aspect to this. And that was back on February 24th that our communications team began looking at this potential this potential virus that might be coming into our community. And this is unlike anything we've ever seen. And I feel like it's really important to recognize we're now in week 13 of pretty heavy response in regards to probably the most significant event that many of us will ever experience. This is like a war, and many of us do not typically have to have a war on our front door. So just know that this has impacted everyone, but particularly I just want to thank my team because they just continue to put in the work, the hours, the effort, and they all come from a place of service and wanting to do the best they can for all of you. And I thank our partners, like, the City of Onalaska and the National Guard and other municipalities, we have many partners, media, businesses, who are all really trying to do the right thing. And also all of you who have given us suggestions and shared feedback, particularly positive feedback with us. It is really helpful to have that level of communication and community, frankly. I think it really is a sign of the strength of the community that we serve from the health department, that we live in, that all of you live in. And it's really very heartwarming to have such community here, knowing that this is a very difficult time. It's hard to continue to be asked to do things that are really difficult, to include not getting together with others outside your household, especially in light of not being ordered to do so. It means that, really it is on each of us to do the right thing. So I just want to sort of send out that thank you to my team and to our community, knowing that it is really through working together that we will continue to take steps forward and get through this peak of the virus, other peaks of the virus, and whatever comes in between, no matter how tough it might be. So thank you from the bottom of my heart. I appreciate all of you. With that, we'll take questions.
Hey, Jen, Justin with WKBT. With everything that's been going on with this safer at home order kind of being dismantled, I guess, is it more or less safe for kids to play sports recreationally? Although I think I have a pretty good guess on what you're going to say. Yeah,
thanks, Justin. We get a lot of questions about what can we do, what can we not do? And really the answer is, we were not allowed to do that under the safer at home order. Our data here in La Crosse and our surrounding communities continue to support that we are not ready to move in that direction yet. Again, knowing the way this virus spreads and the fact that being close with others and congregating with those outside of our household is not advised at this time. I would say, unfortunately, no, we should not get into those types of sports, particularly with our youth. We do not want to be exposing anyone to the virus.
Justin with WKBT again. Earlier you had brought up that, Memorial Day is a pretty special day for a lot of families in terms of camping and just getting together in general. I guess, although we, again, don't have that safer at home order, are you kind of scared or nervous that some of these families might not maybe adhere to some of these guidelines that you've outlined for them?
Yeah, thanks, Justin. So I think that there's a vast majority of individuals in our community who want to do the right thing and who will do the right thing. But we have been asked to do this for quite some time, to take these to do these behavior changes. And I understand the pressure on individuals and on businesses and others. But again, the data does not indicate that we are in a place where we can loosen yet. In fact, when I look at different phases, and we'll have more about this in the future to show you some visuals of what I'm talking about. But I've talked in the past about those data categories, the metrics that we look at in the epidemiology of disease, the metrics in healthcare capacity, the metrics in public health capacity, and they all sort of wrap up into a general phase of, the least restrictive to the most restrictive, and the most restrictive being where we're at right now. We are not in a place where we can let up on those guidelines based upon the data. As soon as we see that we can, we will advise differently. But at this time, we cannot. And I have likened dealing with this virus similar to a war. And I would like to just acknowledge that Memorial Day weekend is not about, it's really not about partying and getting together. It's about thinking about our service members and those that fight for others in our country. And right now, that includes this particular battle. And I think that we need to be careful and make sure that we are following guidelines. I just can't say it enough, because our job is to assure that this virus does not have more and more people to spread to, because it doesn't care who it infects. And we need to plead with all of you to do the right thing. And again, we don't feel like you need to be ordered to know what to do. We rely on making good choices and decisions here to assure that we do not have the spread of the virus to the best of our ability. And the tools that we have, we've laid out in the guidelines, and we really need those to be followed.
Hey, Jen, this is Caitlin with Wisdom. Yesterday, when we shared the 2 cases that were reported and it had said no symptoms, we had some people asking how they were tested if they had no symptoms. Was it just that at that time they'd already been through it, or what was that about?
Yeah, thanks, Caitlin. So we have right now an outbreak at a particular location. And when that happens, again, we always weigh out the value of, do we need to notify the public of a particular outbreak? In this scenario, this facility has notified the public about that. But basically, we had some that were symptomatic and were tested, and we saw enough linkages that then we determined there's an outbreak at that location. And then we look at testing anyone who was potentially in contact. So what we're getting from those asymptomatic individuals that tested positive is a specific testing scenario based upon exposure risk because of an outbreak at a facility. And so those individuals are not symptomatic, or were not symptomatic at the time of the test, but did test positive. And I think, that is important to understand, that that means we're catching it early enough that they could have been spreading it and they weren't yet symptomatic, because we know that individuals may never develop symptoms, may spread it up to 48 hours before developing symptoms. So I think that is a good sign that we're able to catch those individuals, advise them appropriately, and to make sure that we're reducing the potential spread to others. So again, those are all things we've talked about before, but when we see that actually play out and happen, I think it's important to just remember that there can be individuals who do have COVID-19 and are not positive or are not symptomatic, at least at the time, may or may not become symptomatic and can spread the virus.
Caitlin again. Any thoughts on Valley View Mall's announcement that they will be reopening on Friday, I believe?
Yeah, thanks, Caitlin. The thoughts that I have are that we know businesses are opening, and all I can say is that that opening must be done as safely as possible, and to the extent possible for businesses that choose to open, including the mall, assuring that we have all of the appropriate precautions taken and prepared for and ready to go before opening is what we advise. Again, we still don't advise that individuals routinely travel outside of their home beyond what they really need. We should not be congregating with those outside of our household. The mall should not be a hangout location. So it is something I struggle with a little bit, because it is this balance between we don't have an order to tell individuals not to be open, but the risk remains present. And so the best we can do is make sure that those or ask those locations, businesses, the mall, to assure they're doing everything they can to reduce the spread of the virus. If they are to open, it must be done safely.
Any other questions for Jen today? Oh, we have a few more, Jen.
Hey Jen, I know you mentioned the National Guard testing site's going to be a nose swab and not the nasopharyngeal swab. Is the accuracy the same between those two tests?
Yeah, thanks, Haley, for that question. Yes, we believe the accuracy is the same between the nasal and the nasopharyngeal swabs.
Go ahead, Justin.
Yeah, sorry about that. I'm gonna end up putting my hand back down. I thought I had something, but that was my mistake.
That's okay. All right, I think we can wrap up.
Okay, well, coming up with Thursday and the testing event, again, please come out if you have any symptoms at all. We really want to support you, help you get tested, and make sure that you can have the status of knowing, what if you are positive or not, especially if you have symptoms. So I thank you in advance for coming out to the site, and all of those that are making that happen in a safe way. And we'll be back here on Friday. We'll give a report on how the site, the testing site went, and we'll have other information as well. And please do everything you can to be safe and work together to make sure that you're following the guidelines the best that you can. We appreciate all that you're doing, and we'll see you back here on Friday. Have a good rest of your week.